Well, good morning, everyone, and thank you for coming. Welcome to this meeting of Adults Select, which has a particular focus today on managing risks, although that's not the only subject of our interest. It is a particularly important one. And with that in mind, I'm very grateful to the Cabinet Member, Councillor Jeff Burrows, for coming this morning to help us understand these matters. What I'd like to do is to ask you all to introduce yourselves for the benefit of our live audience, and at the same time as that, we'll then note the apologies that we've received, Sarah. So, welcome to our meeting. Can I ask you, Councillor Pauline Watts, to be the first to introduce yourself?
Sorry about that. First big mistake. Pauline Watts from Caldicot Castle Ward in Caldicot.
Thank you, Pauline.
Delia Hudson, Chairman of the Abergavenny Action 50+. I'm a co-opted member.
Good morning, County Councillor Ruth Edwards, elected member for Llantilio Presendi.
Hello, County Councillor Penny Jones, Raglan Ward.
Councillor Alan Wintle, Drybridge Ward, Monmouth.
Councillor Ralph Chapman, member for Mardy Ward.
County Councillor Jeff Burrows, Cabinet Member, Social Care and Health. Thank you, Chair.
Councillor Roger Harris, Vice Chair of the Committee and Member for Cresson Ward in Abergavenny.
Thank you. And Councillor Peter Farley, the Chair of the Committee and the Member for Chepstow St Mary's. Can we ask the officers to introduce themselves as well, please, so that everybody's clear who might be speaking or appearing on camera when the time comes?
Sarah King, Democratic Services.
And Matthew Gatehouse, Policy and Performance Manager.
Tyrone Stokes, Finance Manager for Social Care and Health.
Mark Howcroft, Assistant Head of Finance.
Thank you, Mark. I'm very conscious that one or two of the microphones are a bit temperamental and the lights may not always come on when you want them to. We'll just have to make sure that we are being picked up, and if need be, perhaps even use a different microphone. Right. Apologies for today's meeting have been received from Councillor Martin Hickman, Councillor Paul Jordan, and Mr. David Hill, our second co-opted member. I now move to item 2 on the agenda. Are there any declarations of interest that members wish to make at this stage, or will you be content to raise any as and when the need arises? As and when has it. Thank you. Now we have to confirm and sign the minutes of 2 previous meetings. The first, which you should have in front of you, is the set of minutes for our meeting on the 18th of November. What we'll do, excuse me, we'll go through for accuracy, but to save time, I'll do the signing afterwards with Sarah, if you're content with that. So the first set of minutes that we need to be looking at begin on page 4 of your bundle. Page 1, the meeting on Tuesday the 18th of November. Page 1. Page 2. Page 3. Page 4. Page 5. Is everybody content then that those minutes are accurate? Thank you. I'm not questioning the accuracy of the minutes, but I'm just making an observation. And it suddenly occurred to me, looking through them again, if you were on the outside of the committee and the social services world, would you necessarily know what things like fish bowls are in this context? So I think I'd just like to ask that when we do use technical terms, which clearly this is, and there's no argument about that, that if necessary, we make sure that when the minutes come out, there's some sort of explanation as to what they are. Otherwise, people can easily kind of almost ridicule what we're up, fish bowls, you know. Anyway, that's a small point. But the minutes are accurate, and we have no query with those. Thank you. The second set of minutes to take for accuracy are those from our special meeting on Wednesday, 17th of December. And again, I'll go through page by page. Page 1 of the minute, which is also page 9 of the bundle. Are there any questions of accuracy there?
Yes, please. Just a minor point, but I did actually offer my apologies for my non-attendance.
I beg your pardon, Delia. Can we note that, please? Thank you very much. Any other items on page 1? Councillor Jones, where are we, please?
Bottom of page 1. It's just a spelling error. We were at the last line, the bottom of the page.
Oh, yes. I missed that. While we were still awaiting, yes. There's a missing E. Well spotted. Thank you. On page 2, page 10 of the bundle, there is a similar slip in the bold, capitalised heading in the middle there, to scrutinise, not to scrutine. Although scrutine does sound a rather useful. It meant it should be scrutinised, presumably. Okay, any others? Page 3, page 11 of the bundle. Page 4 and page 5. Thank you. Can we record at this point that as he immediately after the meeting said he would, in Bakewell sent us a briefing to answer points that we had raised, and I trust that that was to members' satisfaction and that there were no return questions. Is that fair? Thank you very much. So 2 sets of minutes dealt with there. Thank you very much. And now then we come to strategic risk assessment. I'm going to ask Matthew to take us into this. We will be asking questions, and I think Jeff has agreed to kind of lead on the answers, but clearly is entitled to phone a friend or whatever the current phrase is. And we're grateful to Jeff for coming, particularly as I gather you're not particularly well this morning, so we match each other quite nicely. So, Matthew, we are at your disposal.
Thank you very much, Chair. Just to remind members briefly, you've seen the risk assessment in an earlier format in December. The purpose of bringing it back is twofold, one of which is to respond to some of the comments raised by members at that session, and some amendments have been made to the document. The other reasons being to allow you as members to hold the executive and to hold officers to account against the risks and the mitigating actions in the risk assessment. And finally, to enable you to have information to help you plan your work programme for the coming year. Just to restate, I think it was sort of Teresa that brought this item in December. What we're looking to do with a risk assessment, it's historically been something which is signed off by Cabinet. That continues. This will be a decision of Cabinet in March. But we propose, because the pace of change for ourselves as all local authorities and public services is so great at the moment and things are moving so quickly, that we're proposing move into a live risk assessment. So what that means is really we update it as and when new information comes in, and the latest version will always be available to members to access from the hub. So alongside the performance information you can access, you'll be able to access the risk assessment. So how that works, for example, if we have an audit that takes place in July, when we get the findings of that audit, we will build them into the risk assessment in July, so they're available at the earliest opportunity, which means for you as members, that's available as a reference point to hold officers to account. But it does also mean that if there are pressing issues which need to be built into your work programme, you're not in a situation that you're not getting this risk assessment until the following December or January.
Come in there. That's interesting. If we're going live, and you say it's going to be on the hub, I'm rather loath to say to increase the load on emails, but not many of us will be necessarily looking at the hub every day. And if there's a major change, there ought to be some other way of flagging up to us. And I wonder if you could consider that, even if it's in the form of an email, even in the form of an email in different colour, ink or whatever. If it's really important, we should know some other way.
Absolutely, Councillor. I think that's a very good point and something that would be fairly easy for us to do. So within the risk assessment, it's marked which committee and which Cabinet member risks relate to. If something changes in the course of the year, if members are happy to receive another email, what we'll simply do is just send out an alert with a hyperlink through, so you can simply click on that and access the document.
I'm sure members would find that very helpful. So we can look forward to some form of an alert system, just the same as the public health world has alerts. If the figures for, I don't know, dengue fever go up, then you get an alert. And it's exactly the same here. You don't need to watch everything all the time, but key changes are brought to the attention of the committee. And without going into any more detail about how it will be done, what the format will be, I think that's a very welcome development, which isn't just for the benefit of the committee, of course. I'm sure it will help, not least it will help Jeff as well, and the team as a whole, who may not be instantly aware of everything, and how could they be? Thank you. Okay, Matthew, do continue if you want to.
Thank you, Chair. The other points to say around this is that the report covers just high and medium level risks. It does not purport to cover every single risk facing the authority, and there are a number of issues that will come in through the year. The way lower level risks is managed is through teams' service plans. So all of our teams have a service plan. As part of that plan, there is a risk assessment. And what we tend to say is, as a rule of thumb on that, the lower level risks are things which generally can be managed within the team or between the team and the directorate, and don't necessarily, with the mitigating actions we have in place, bubble up to the sorts of levels where they pose the sorts of reputational risk or risk to harm of individuals that needs input at a more senior or on a regular sort of member level and input. So there's sort of things, if we're looking at social care and health, for example, that Simon feels his team are comfortably managing with their existing resources. So it's not to say it's not a risk, but that the mitigations in place are such that it's a lower level risk and therefore doesn't sort of rise up to this document. There may, of course, be issues which you feel sit in those team plans that you as members feel should sit on the higher level risk assessment. And if there is evidence that that risk level is appropriate to sit here, that's of course something, if it's the view of the committee, we would bring into this document. The other thing we would say in relation to this, just in terms of some of the changes to this document since you saw it in December. In response to member feedback, and actually I think something which is good practice, what you see in terms of Appendix 1, page 3 of the report, page 16 of the bundle, is the risk log table itself. And we've categorised risks as high, medium or low. But obviously that's made up on how likely something is to happen and what the impact is. So what we've done in response, as I said, to what we heard at the last committee, is to itemise that likelihood and impact to help inform the debate and discussion. And those levels relate back to a grid, which is at the end of that, page 12 of the report, page 25 of the bundle. And this is where there's another change. I think the language, we had some feedback on that grid as it came to you last time wasn't helpful. And it actually made it very hard for a risk to be a high level risk. What we tried to do in previous years, those had simply been numbers. And it's quite interesting that actually when you put words on it, it really encourages the discussion, because when we put words alongside that, it made us realise actually some of the categorisation did need to be challenged, and you were right in doing that. So the wording of those labels, or particularly in terms of impact and severity, has been amended. So we now have the highest risk being major, then substantial, moderate, and minor being the lowest level risk. So in terms of, if I just pause there, Chair, with your permission, in case there's anything I've said at those points that people wish to raise questions on before we move on to the risk itself.
Yes, that's helpful. Are there any points people want to make about? It's really the changes that have been made to the way the document is presented that we're really concerned with here, not the individual issues that we might want to go into in a few minutes, but whether we recognise that following those earlier discussions before Christmas, there have been changes made to the document, and whether or not we feel they are for the better as they were intended to be. I think Matthew would find it helpful to know if we are content with the changes as they are coming through. I mean, Councillor Jones, Penny.
Yes, I find it quite clear to read and assess. I find it clearer. I just got to, I don't know whether to ask it now, but in the light of it, or later. It seems a very brief document. Is this just the update now, or is there more, from December? I don't understand how it suddenly becomes so minimalist.
Well, I think what we had in December, if my memory serves me correctly, is we brought to you a sign-off of the risks from the previous year to almost close off the risks that weren't moving forward. So you had almost a Part A and a Part B to the report. So what we said is risks that were on the risk assessment have been adequately dealt with, no longer feature. And what you're seeing here is kind of a clean cut almost from this point forward. But it is very intentional that some of the feedback we'd had in previous years around the risk assessment was that it lacked some degree of ownership. And I'm not looking at members here, but certainly amongst officers. And one of the reasons it lacked ownership was it had become quite a large and complex document with a large amount of text.
Yeah.
And it's about striking that balance between having enough information that the risks are understood, but not having so much that actually almost you're sort of drowning in information and therefore unable to distill the knowledge from it. So what we're hoping to strike is the right medium. If at any point we're not getting that right, of course, please let us know. But in keeping it brief, we hope it becomes a usable document that people can look at fairly quickly, take the information they need and use it, whether that's for scrutiny or other means.
Thank you. Well, with that in mind, I do find it very clear and coherent and much better than the bulky documents we had to wade through before, and I certainly think that helps. But there are one or two aspects that seem to be missing or aren't there. And I wondered if that was intentional because there is no risk associated other than low. And in particular, I'm thinking of community coordination, care in the community, encouraging independent living, the Raglan project, the pilots, for instance, that we are doing. I wondered where they would fit into this and whether they need to fit into this.
If perhaps I come back initially, maybe Councillor Burrows may choose to step in. But again, in terms of those issues, yes, where they're at in terms of the project management, the arrangements in place around those specific projects, the feeling is that the arrangements are appropriate and that those are sort of managed and being delivered. Cabinet initially agreed the funding for them, the people are in posts, and the feedback we have to date is such that they are on course. Where, of course, we do continue and will face significant risks and pressures are perhaps around the broader issues of sort of demographics and finances. How do we continue to sustain services? So that's in there as a broader point. But regarding the specifics of the delivery of community coordination, for example, the assessment has been that it's a lower level risk.
Yes, indeed. I was going to say, Jeff, do you want to come in on this?
Yeah, I think really this is actually a good example of the work that's been done to date in really trying to understand the mechanisms of council about what actually gets the community coordination and the strategic direction that we want to make. That the two link together, but like with so many subjects here, we cannot separate by a dividing line one area. That there is cause and effect and relationship between the two. But certainly now that this is I would suggest that if community coordination had not started and it was being flagged up as a potential way going forward of actually transforming the way we deliver services, I would see it at a strategic level about the potential impact going forward. It would feature on here. But now it's actually live and it's happening. It's owned by the people that are actually undertaking it, and therefore there are links to the strategic document, but it is very much, in my view, now live and operational.
As a document, it's very, you can see it. It's basically, it seems like the highlights are the headings of the various areas, which is good. But the bit that sort of confuses me, we haven't got enough, I suppose, pointers to where we get the real information. You give us the headlines basically, and what's there. But where do we access the main information? That seems to be the bit that's missing from my point of view. But you've explained, it's all right when you're in the room, Matthew, because you've explained a lot of it. But for us mere mortals, how do we get that information?
Well, I think that's a good challenge, because actually, in order sometimes to understand some of this, some members, some officers may be seeking to dip below the level that is here towards some of that source evidence. What we don't want to necessarily do is bring all of that source evidence in, because it loses that clarity that members have just been describing. And I wonder if perhaps one route, and perhaps we'll look at a couple of options and perhaps sound people out informally on this, maybe, for example, the use of sort of hyperlinks and so on to other documents, so that if there is a key piece of information, and, for example, we are saying demographic pressures, that actually we can link through to the report that says, population age 85 plus will increase by 121%. This sort of thing. So actually that gives you the assurance that the statement in here is backed up by evidence, and should people choose to go into that, they can do so. But what I wouldn't want to do is load it all back into the document itself.
That's my point.
Yes, please. Thank you, Chair. Yeah, I support that. I think it's a good idea, this link, because it's very easy and very efficient way of actually facilitating where information can be found. But equally, what we have there is the two columns that say service and risk owner and cabinet member. So if something specifically comes up, there's a name against it, and the easiest thing to do is actually ask. and it will be forthcoming. If there's something very specific, there is ownership of these various risks. And so, for example, with the two have got my name against them, then I welcome any comments or any inquiries for information and background. It's there to be asked. Thank you.
Thank you, and I'm sure the committee welcomes that statement and will want to note it. I think we're getting into into a number of areas now where, from our pre-meeting, individual members signalled that they did have an interest in asking a question or two. I'm going to hold back with mine for the moment. Councillor Harris, Roger.
Thank you, Chair. Matthew, you've indicated that maybe a particular topic or item, in fact, I think they're all going to be subjective to a certain extent, i.e. the person looking at the risk is going to ask particular questions, but it may be that he or she doesn't ask a relevant question because they personally don't think it's relevant. And obviously the whole topic is or could be a minefield. Do you have something like a tick list so that you know that absolutely fundamental questions have been asked and ticked off as part of the process? Because, for example, if something went wrong, it might be that we just hadn't thought about considering that aspect as being a risk, and suddenly it's come out and bitten us. So I don't know if there's a sort of generic list that spurs you on to, or we're not quite sure about that one, i.e. will it spur us on to further questioning?
Yeah, thank you, Councillor Harris. And a couple of things to say in response to that. In terms of the questioning, we try as far as possible to ensure that members are equipped with the skills to look at and challenge the risk assessment. And our past experience seems to suggest that is working. So I think in the past we've invited Zurich in, our insurers, and Zurich have done some briefing sessions with members on risk assessment. Of course, the nature of risk itself is that we are almost sort of trying to predict the future based on the evidence we have. And there is a degree of uncertainty around it. So our approach to that is to gather as much intelligence of the known things that we can. There is, around this, there may always be unforeseen issues that are not featured in the risk assessment. What we try and do to mitigate against that is today is a very good example of it, is we take it through as many different audiences as possible, because actually collectively the knowledge that exists amongst officers of technical areas and of members around the policy direction of the authority and the issues present in their ward, we hope brings enough collective intelligence to give a fairly thorough risk assessment. So we have some pretty thorough processes we go through. But as to say a tick sheet as such, we follow the sort of guidance that's been brought in through Zurich and so on. But in a sense, that doesn't prepare us for the fact that something could crop up which we haven't anticipated. And in a sense, by its very nature, we don't know what that is at the present time.
It's true. I mean, members will recall. I can't remember now who has been able to attend what, but it's true that we did have some very useful training, and always remember the adage that prophecy is particularly difficult with respect to the future.
A couple of observations really following up from that is obviously once something has been identified as a risk and an assessment as to what level of risk that is, once that's been on the document for quite some time, as time goes by, the evidence of reality starts to impact on actually whether or not that initial assessment was valid, or whether it's too strong or too weak. And as time goes by, you get a better sense, because the actual what happens during the day will actually give you a sense of whether or not it was a good assessment or not. And really the other part of it really is that the more you actually talk about risk awareness, one actually is an inverse proportion to the other, and the more you become aware and discuss about risks, inherently you actually start to reduce the risk because it's being talked about and the issues are being made aware to everybody, and therefore cause and effect comes out of that, and mitigation as a consequence of people it being on everyone's radar. Thanks.
Thank you. Are there any members with specific questions waiting to be asked before we go on to one or two of the ones that we talked about earlier?
Sorry, Chair. Well, there is a specific question I wish to ask, but it's affecting the next section, which is in the finances, which again is a risk in my ward, and it's about the Monovale partnership. Obviously, it's something that I think I got an idea about it, because unfortunately, being a bit longer in the tooth than most of you here, I've seen what the development of Monovale from what was there before to what it is now. But I still like to know what this cost apportionments and residential care costs exceeding recovery due to means of testing, which is, it's on page 29 on section, our agenda item 6, which you might have handy to you. It's in adult services, and it seems to be worsening, which is in red, so which makes me sort of ask the question.
I think, Councillor, that's in the next
It's in the next
item.
one.
So I'd sort of look to the chair as to how you wish to.
Yeah.
I think we should note the question. We come back for the, as it were, the financial answer when Mark and Tyrone speak to us. But I think Councillor Wintle has a valid point that this might, because what he's asking, as I understand it, Alan, is this an example of something which actually ought to be reflected in the risk register? It might appear to us today, and quite rightly, on the next item and so on, and it's in the sort of the finance box, no problem about that. But I think what you're saying is this actually a risk which is somehow not acknowledged in the risk registry? Have I got you right?
Yes, because as people probably realised over the past year or so, the Aneurin Bevan Health Board is are withdrawing services back to the well, it seems like Torvine and Blaina Gwent, and removing things from Monmouthshire almost. Like for medical services, we need to go to Neville Hall or Newport, which is 20 odd miles away. So it is a risk to my community really, and to the Monmouth area. So which makes me concerned.
Yeah, I mean, in terms of the issue of whether that sort of specifically the Monovale issue would feature in the risk assessment, I think looking at the way it's picked up here, and I'm sure that it will come up in more detail later on. The sort of sums of money involved, and though we have to be absolutely tight on every single pound of public money we spend, sort of relatively speaking in terms of the budget, it probably wouldn't be on a level where it would sit for financial reasons. If there are some service implications, as you mentioned, Councillor Wintle, that members choose to explore. I mean, it's not something we have in here in that format at the present time. It could be an issue that sort of members choose to discuss more fully. I think at that moment, probably I don't feel qualified to comment on that at the moment because I don't have that sort of knowledge or information at hand. It could be something that warrants a question to the Chief Officer or the Head of Adult Services as to their assessment of that situation and whether they would see it flowing into this live risk assessment at a point in future as we move through the year.
Thank you for that. But it does raise an interesting question about actually risks. Whose risks are we actually taking account of? And you're actually, Alan, as I understand it, offering a quite different take. You're saying, what assessments are we making of risks to our communities as opposed to risks to us as an organisation, which of course are important, but they're not completely the same, are they? Can we then go on to one or two other things? This would be a timely point, Jeff, if I could ask you what I would like to term a question really about the culture, really. Thinking of the culture within, your portfolio, a significant portfolio, I wonder if you could give us a flavour of how the risk register and risk assessment are sort of handled. Is it something that you, to exaggerate, wake up every morning thinking about, or is it something which is, say, a regular agenda item in your meetings? How is it sort of woven into the day-to-day running of the portfolio? And I think members will be genuinely fascinated to have your take on that. It's not a trick question.
Thank you, Chair. I think really the best way to describe my relationship in all of this is that clearly an organisation that provides so many complicated, disparate services, you have to find a way of actually linking all of that together. And so as a consequence, communications between line management, up and down and laterally, have to be formed in areas of trust, teams working together. One thing that we as an authority are very good at is actually giving responsibility right down to the front line for decision making, because really truly successful organisations are those who actually really understand about allowing decision making to flow to the furthest points, because with responsibility then comes morale and all the things that follow it. As far as my linking to all of this is that, as we were discussing earlier, there are areas of risk that are easily encapsulated in the day-to-day stuff, as we've just been talking. I take note about this one that you could see probably a little bit on the borderline, and because of community implications and the risk to them as a consequence of something that in financial terms may not be significant and feature on the radar of some of the more serious things that we're trying to manage out. But what I do, and have been doing now, for, goodness me, informally all the time that I've been a cabinet member, and certainly formally for this last 12, 15 months in readiness for our corporate assessment coming up later in the year, is to actually ensure that I have regular, meaningful meetings with both the heads of service, both Tracy and Julie, on a periodic basis, and they are dependent purely on the need for those meetings, not setting arbitrary dates just to kind of tick a box. It's actually a question of, with Tracy, for example, I meet again tomorrow. These are kind of almost like fortnightly events that have been logged and recorded as to exactly what's been discussed and what are the outcomes. And what comes out of that general one-to-one conversation is a huge amount of stuff. It is some of the really serious, blue sky stuff that's going on, and sometimes quite some minutiae as well. So I get very much a sense of the kind of the pulse of my side of the authority from my relationships and conversations with Tracy, with Julie, with Simon, and also with Jane Rogers, because one area that has been particularly important this last 12 months has been the conversations that we've had regarding safeguarding and the vulnerable. So I hope that gives you a sense of how I work in that it is a semi-formal relationship, in that I ask that each time I meet with these individuals that they give me a thorough sense and their perspective of what is going on within their sphere of responsibility. And of course, having not only the heads of service and then the chief officer, I get then two separate distinct perspectives on the same subject from two separate officers on the same story. So that's basically how I've tried to manage it over the intervening period. But certainly, it's not an easy thing to do. And certainly, the one thing that we always have, particularly in social services, is you just don't know what today's going to bring. So it's a question of this understanding and risk mitigation wherever you are. Thank you.
I'm sure members will appreciate that frankness, and it's quite clear that you bring to the whole process experience of managing risks in other spheres of life as well. Do members want to pick up on any of those things? I think that was actually very helpful, and thank you. There's a couple of other questions that I think are down to me to ask, and they're in the territory now, not of the culture. I mean, I'm satisfied with what we've heard there, but they're to do with things that perhaps one or two of us might have expected to see flagged up, but actually may not be, or at least if they are, then they might not be as visible as they could have been expected to be. The first one, which I'd like to mention, and I'm speaking in very general terms now, I have no specific example in mind, but it's the kind of thing that goes on around the country, so it would be no surprise were it not also to be going on within our county and our authority. It's where there is a risk to both our citizens and the council from, shall we say, a private provider, and probably a significant private provider, getting into difficulties. And what we do to keep our eyes open on those issues, what we do to manage that particular kind of risk. I think you know what I'm getting at. Nowhere specific in mind, but it must be the case from time to time that that is the kind of risk that surfaces, and when it does surface, could probably do so with a vengeance.
Thank you, Chair. Yes, I'm obviously, whilst we're talking generalities here for all the obvious reasons, yes, there is a specific that I'm aware that you're talking about. These kind of issues will crop up from time to time. It's just the way of life. I think the important thing, as far as I'm concerned, is to ensure that as and when we travel through the journey, that whatever this particular issue is that we're comfortable that the right decisions based on the information known at any one time, the correct ones, are being taken, are right, projected going forward. One thing that will happen in issues of concern with private providers is that it is not a one-to-one relationship with them and ourselves. There will be other authorities, there will be the health board, there will be inspectorates who will also be actually involved, and as a consequence of that, the important thing as far as I'm concerned is ensuring that there is complete and thorough sharing of information, a complete and thorough understanding of the circumstances prevailing at the time, and that there are models of options that are open at any one time to mitigate what is actually going on. Because clearly, sometimes risks such as these can then take on a life of their own and move very quickly, and we've got to be in a position to respond. So an awful lot of time and officer effort goes into the mitigating of these kind of circumstances, when it does, it is partly my responsibility to actually be having those conversations with those who are involved, that from my lay perspective, frankly, as merely a councillor, that I'm getting a good understanding of what's going on, such that I can interpret how it would be perceived by the general public as and when and if something like this comes to light. That there are so many things that we are responsible for. There are some things that are just beyond our responsibility, but we try to do the best that we can. But sometimes it is ensuring that there is clarity of purpose and clarity of information as to exactly what the circumstances are and the decisions that were made were the correct ones at the time. Because we all know that we all have the value of hindsight, and people go say, well, that was a bit of a poor decision. But it wasn't if at the time the evidence shows that that was the most likely potential outcome to be a good decision. We're all human, and that happens. So that's my take on it, if that helps.
Thank you. That's very helpful. And I wonder if I heard you right, behind some of the things you've just told us, seems to me to be a scenario whereby actually Monmouthshire County Council isn't necessarily, shall we say, bilaterally involved in a particular situation of this sort, that actually we are working with other agencies, we have links with other social services, other organisations, really across the region, if you like, and that is all part of how we could, if necessary, handle such a situation.
If I could just add to that. Of course, clearly, when you have things like private providers, they, in many respects, don't actually just recognise the borders of Monmouthshire. And you are probably a very small provider, it may well be the case, but something that is of significance will probably be drawing in from other authorities as well. So there's a much larger scheme of things that we're working with, and certainly in terms of partnership working with others, it does impact on others as well. And clearly having collaboration, thorough understanding at each point in the journey is vitally important. We are commissioners of service, and we expect the service to be delivered to the standard and quality that we're paying for. And if for any reason things are starting not to be the way that we demand it, then clearly there's all sorts of processes involved where we individually can get involved and actually start helping and assisting an organisation. If it's getting beyond the pale, there will be other authorities, that will CSSIW and others who actually are the licensees for such premises that can get involved as well. So once the ball starts rolling, it becomes very much a partnership and a collective decision-making process, not us just in isolation.
Thank you very much. Councillor Edwards, Ruth.
Thank you, Chair. It's just reassuring that the Cabinet member has given us that explanation, because all well and good, the people who depend on that care are very vulnerable in their times of life. And that's the last thing they need, is any stress to worry about, what is going on beyond their control. And it's nice to know that somebody does always look out for them. Thank you.
Then of the questions raised previous to our actual conversation now, there was another one which I think I was going to ask when it came to it, and it's a completely different one this time, Jeff, and it's really to do with, I think, the context in which you're managing risks, and the officers, of course, working with you are managing risks, but some of the exposure might actually be to either another part of our own organisation or the equivalent of that. So, for example, a number of services rely upon good IT support, software development, all that kind of stuff. SRS would be the major service involved, and that doesn't appear as a risk. Is that because it isn't a risk, or because it's so well managed that it doesn't need to be there? You see where I'm coming from. We've looked at how we manage external threats, if you like, but there's also possibly some internal ones, and that's an example.
If we take the example of IT, for example, obviously we're all, from our own daily lives, we know that this doesn't stand still, and there's always development, there's always something bright and new around the corner. And in terms of robustness of IT, I would suggest that things can always be improved. But certainly, as far as social care is concerned, I mean, we've been putting a huge amount of investment in a fantastic new system that will be coming online probably around about March, April time of this year, that will be totally idiosyncratic for Monmouthshire County Council and Monmouthshire's needs, which will actually integrate health and social care. It's going to bring on all sorts of benefits, not least through Frailty, even though Frailty has its own IT integrated approach. But certainly, actually, when you hear other authorities struggling with the concept of trying to merge and blend those two information organisations together, that we're just getting on and doing it, I would suggest that whilst you can't predict anything, I mean, we hope that it comes to fruition, but everything is suggesting so far that is the case. I mean, we have glitches, we have SRS going down and leaving us high and dry with no emails for 24 hours, and that's life. But certainly my sense of where we are as an authority, and particularly in my portfolio and what we're doing, we are proactive. We're actually going out and going to be delivering for ourselves, by ourselves, a product that has been designed for us, and therefore I think will stand on its own 2 feet in that respect. And a bit like we might even sell it on. Thank you, Chair.
So it doesn't sound as though you're anticipating one of the sort of perennial problems in health and social care, of the systems being very impressive but not being able to talk to each other. It doesn't sound as though you're expecting that.
No, this has been designed really from the bottom up. It's actually a piece of work that is actually taking longer than expected, but is actually going to really thoroughly underpin everything we do in terms of our relationship with health in all of our integrated working. So I'm very confident that this will be as good as it gets within the budget confines of what we can spend on it.
Thank you. I'm sure members will found that answer interesting and may well want to consider at a point further down the track, closer to the sort of timeline that Jeff's just set out for us, may well want to consider hearing about it in the committee. It's clearly a significant piece of development of our local infrastructure, and it sounds as though there might well be, well, we hope there will be, some good news to share with us.
I understand that just before Christmas, I wasn't involved because it was an impromptu visit, but Mark Drakeford came over to Monmouthshire with a view just popping in for half an hour just to catch up. This was explained to him, and he stayed for nearly 2 hours getting a thorough insight, because there's a lot of talk at the moment about what Wales as a whole does, and there is an awful lot of work being discussed about province-wide solutions to this, and we're saying we don't believe that's the case, and our small authority is actually going its own way and showing that we can deliver something that actually works. The fact he spent much longer than anticipated listening to what we had to say was an encouraging sign, I would suggest.
Indeed, and a very good point for the staff involved to get that kind of recognition. Councillor Wintle.
I'm very interested in what you're saying there, Jeff. My major concern is that, unfortunately, the health service can't talk to, from one hospital can't talk to another hospital at the present moment. So how on earth are you going to manage to get on with those?
I have a lot of remits, Alan, but getting hospitals to talk to each other, thankfully, is not one of them. I mean, what I'm looking to ensure is that in all our dealings with our integrated teams, that they have the tools in order to be effective, given the circumstances we find ourselves in trying to transform our services, working together, getting people at the centre of everything that we do, and providing that it works for them, then, frankly, that's very much one for the ABUHP to deal with.
Okay, well, I think we're drawing towards the end of this particular part of the meeting. I know that Councillor Harris has a specific, actually on the register now, we're talking about things that are actually on it, not that aren't on it, that you want to ask. Will you take us to the particular reference, please?
Thank you, Chair. Yes, it's on page 5, bundle page 18, item 6. And I wonder if Matthew can talk us through this particular one. It's potential for significant harm to vulnerable children or adults due to factors outside our control. And in the next paragraph, it indicates there will always be a high risk. But if you look at the risk level for the 3 years in here, it's medium. And I just wonder, Matthew, if you could talk us through the scenario why there will always be a high risk, but it's classified as medium all the way through.
Simple answer, Councillor Harris, you've got me there. No, it was in the earlier draft of the no, in the earlier draft of the risk assessment, you recall at the beginning of this, I said we looked again at the grid, because some of the language in that made it hard to classify things correctly as high. And as part of refreshing that grid, we looked again at this, and it's an odd one. It's a risk in terms of harm to individuals we can never ignore. The nature of society is such, unfortunate though it is, that this is done, and sometimes, no matter how effective our processes or how good our systems, unfortunately, things will happen with tragic consequences. Now, certain things are preventable. In the first draft of this, we classified that risk as high. When we looked again at the language around this, we said, well, of course, the consequences of harm to individuals is major, or major, depending on the individual case and so on. But actually, the likelihood in any given period, we looked at it, is not almost certain. We may look over a period of 6 or 7 or 8 years and say we would expect to have one case of a very serious nature. But over the course of this risk assessment, we couldn't say that is likely or almost certain. So in that case, we downgraded the risk assessment. And why I use that, you got me, is essentially it's an error on my part that I didn't pick up that change and feed it through into the text. So that should read, will be continues to have major and substantial consequences for us, but in terms of its likelihood of occurrence in any given year or any given period, it's assessed as a medium.
Just come in there. Thank you. You've answered the question because superbly, not adequately, because within all of these factors, you have to take into account things like that, and we, as amateurs, if you like, look at that and think, well, what, it says high risk down there, and it's medium, but you thought about it, and you can explain why you have come to that decision, as opposed to just put that down there and nobody's going to ask that question. It's obviously been thought about, and that's the important thing about all these risk factors. Some of us will be looking at it and think, I really don't understand that. And obviously, as Penny has said, we can't have all that detail, otherwise we'd be here for forevermore. But it's just good to know that you're not sat there thinking, oh, crikey, what do I say next? Because you've thought about it. Thank you, Chair.
Thank you, Roger. I think really, just to add to that, I mean, obviously, the pragmatism, he says, I would just take out the word high, that is a risk. I mean, certainly this was high before. What we've embarked on since the inspections a couple of years ago is that it's been shown that we had an awful lot to do regarding safeguarding, and that has now, in the intervening period, been pretty much on the forefront of a lot of people's agendas and time, and to the extent that I would suggest now that we are on a journey of reducing, as a consequence of increased, my point earlier about the more you become aware of a risk, by virtue, it starts to kind of come away from the brink a little bit because people are more talking about it more. I mean, certainly, for those of you who've read my notes for next council, there will be another point that will be underpinning safeguarding, such that it would have started now, but for the fact it was delayed before because of the Christmas meeting, that every single report going through this authority from now on, post a week on Thursday, providing people are happy with it, is that every single report, whether it be Cabinet, full Council or Select, will actually have implications at the back, which we'll actually have to address. The author will have to consider what impact for safeguarding and corporate parenting that report actually has, and therefore it means that absolutely everything that we do henceforth in our decision making will actually have safeguarding tagged to it. Now, for me, that is a way of just bringing the risk down a little bit more, because more people are talking about it, more people understand, more people are vigilant, and as a consequence, perhaps we just make people a little bit safer. Thank you.
Colleagues, I think we've come to the end of this part of the meeting. Can I draw some very broad conclusions from what we've said? And the first thing to say, I think, is to record our appreciation for the contribution and the candour that Jeff has made to this meeting. I, for one, have found it illuminating, and I hope that other members have, to see how considered this whole aspect of the work is and how embedded it is in the way in which, as a cabinet member, Jeff discharges his leadership function. So I'm not about to be a Margaret Hodge on this one. I do applaud that, and thank you for your answers. I'm also conscious that for circumstances beyond his control and ours, Jeff hasn't had the opportunity to bring with him this morning perhaps all the management support that we might have expected. But we understand why that was the case. And actually, I'm not sure it's actually made a great deal of difference. And I mean that in a very friendly way. We've heard about some developments in all of this, which we have welcomed. We recognise that this is, of course, a living document, and that as time goes on, it will become even more so. And we were particularly interested in the idea of the alert system that can be considered and brought in, and sort of linkages with other documentation which therefore would prevent this becoming, once again, a large, I almost said bloated document. It is actually readable in this form. And I think we appreciate that this is an ongoing process. It'll never be the perfect document. For us to think about or to leave, particularly, I guess, Matthew, to think about in concert with others, there has been a suggestion, I think, on more than one occasion during the meeting, that one or two matters that we might have expected to see here were not explicitly flagged up. And I think we would like some consideration to be given to that. In particular, we've mentioned the community coordination side of things. We particularly mentioned the implications of a significant provider getting into difficulty. We've had good answers on these questions. It was just a matter of whether in the further evolution of the risk register, some of those points might need to be taken into account. And we also had some full answers to some individual and specific questions about why one set of risks was described as it is, but actually recorded in a slightly different way. This is the medium and high one that Councillor Harris took us to. We've had a good answer on that. We know that that can be addressed. And we've also said that we've listened with interest to the progress on the IT side, and although that isn't our main focus this morning, it has been a very useful and relevant part of the discussion, and that at some point we would like to hear more about that in the committee. So I think my suggestion to the committee is that we are satisfied with what we've heard this morning, and we appreciate the trouble that's been taken to answer our questions. Is there any dissent from that? Good, thank you. So we can now discharge you, Matthew. Jeff, I don't know whether you want to be released as well. I should think so. Go and have some paracetamol. And we'll welcome to the stage Mark and Tyrone, and thank you both very much indeed. our committee, Mark, and we look forward to you taking us through the highlights that we, in your view, need to be considering. Thank you.
Thank you, Chair. As the Chair suggested, I'll take you through the report. Obviously, if you've got any questions around the detail around adult services that you want to explore later on, Tyrone's here that has a better understanding of the service area specifically. The report builds upon the one that you received at month 3. It seeks to refine the way that we're actually approaching financial monitoring. So you'll notice that that it's the same report that Cabinet sees, so that you're able to get a context both in relation to the portfolio area for adult, but also to get that more general overview of council services. It also, as a change from traditional reports, where it identifies problems or weaknesses, seeks to address those by way of recommendation. So it spends less time repeating problems throughout the year there and actually identifying and providing a recommendation that is designed to mitigate that. Consequently, the recommendation sections in these new reports are a lot longer than they were previously. Probably the most key information is on page 27, the summary report, which indicates £166,000 adverse situation based on month 6 information. That's better than what has been experienced in past years, but you'll notice that there is still a significant adverse situation in net costs of services of 805,000. Clearly it's on a reducing trend, so it's a lot better than it was identified at month 3, which is the right direction to go in, but there's still quite a lot of work to be done amongst services to achieve a balanced bottom line. It'd be fair to say that the outturn at the moment is skewed by the level of re-engineering that's going on within services and redundancies. And you'll notice in paragraph 3.16 that included in that 166,000 adverse situation is £327,000 worth of redundancy costs that wouldn't be a budgeted expense. Paragraph 3.1.9 then covers off the more notable over and underspends in the various service areas, and I've used the same convention as I did at month 3, that a red situation is an adverse situation and a green one is a favourable one. And you'll notice in relation to adult services that the indicative forecast to the year end is a £70,000 underspend. It shows a £51,000 overspend because mandated savings as part of the budget process for 14-15 totalling 121,000 haven't actually been made. A large proportion of that is due to corporate savings that social care are expected to absorb in part, that they're not able to do so. The other smaller overspend is caused by a presumption around community meals income that hasn't materialised as of yet. So the report goes round and explores both the revenue position that we've just talked about, but also capital. So it starts in section 3.4. Perhaps capital is less significant to the adult portfolio than it is to other service areas. At the start of the year, the budget was as small as £59,000 in related to property maintenance at the likes of Mardy Park, which were anticipated to show a £29,000 overspend given the costs associated with boiler replacement at that site. During the year, a requirement has been made to the capital programme to add in an extra £200,000 to the adult capital portfolio, and that's as a result of the swift IT replacement and the work that's going on to provide a bespoke in-house solution. The arrangements for the financing of that are such that it's treated initially as capital expenditure, but it will be paid for over time from the savings in the licence fees that we no longer have to pay to outside suppliers. I encourage all members to have a look at paragraph 3.5.4, which is our indication around usable capital receipts forecasts. You'll appreciate that recently the Council has subscribed to a 21st Century Schools agenda, which requires us to use an anticipated £32 million worth of receipts to help facilitate such. It'd be fair to say that we don't actually have £32 million worth of receipts in the bank at the moment, but that's not unusual. And actually, we don't need all that money right now. It's a 5-year programme, and obviously the key to this is making sure that we have the receipts when the expenditure occurs. So that's why it needs to be on members' radar. Appendix 1 then goes into details around the individual savings mandates to remind members what savings were agreed as part of the 14-15 budget and the progress to date. But we've talked briefly about the fact that the 2 areas of mandated savings that are of concern to adults are around the additional payments and the community meals. The other savings mandates have been progressed and delivered and are on track, things like My Day, My Life. I then refer you to Appendix 4, which starts on page 66, which gives you the adult portfolio perspective to all this. And similar to the convention above, it just goes into more detail as to the various areas within adult and whether they're over or underspent. So the comment earlier around the Monovale partnership, yes, it does exhibit an overspend situation. It is something that I regard as a financial risk going forward, and it will be a feature in the monitoring on a quarterly basis for you to keep on your radar. I think what you were talking was more about the relationship management and the risk around health and MTC's arrangements, and obviously that has a bearing on things like the local service board and the overall integrated service plan that the council and local health board sign up to. But you're absolutely right that actually when we hear in the press the likes of pressures to the health authorities, restricting resources to the public sector generally, obviously there's a potential for the finance to prove to be a point of friction around this, when actually you need the arrangement to be robust and helpful rather than necessarily adversarial. So we'll keep an eye on that.
Are you satisfied with that, Councillor Wintle? We've tried to bring it back into this from where you raised it before. Thank you for that, Mark.
I suspect there are a number of theatres where this will pan out. I don't think there's any one panacea, but obviously you can appreciate that we have a handle on understanding the financial context to that relationship, which may be a good trigger or indicator for you going forward.
I'd just like to add to that as well. On a quarterly basis, we do meet up with health colleagues. Eve Parkinson, who manages the Monovale scheme from Monmouthshire County Council, meets with the health counterparts. I'm included in our meeting, and I meet with my health counterparts, and we look at not only service delivery, but also financial control as well.
Can I just, my major concern is because we've attempted to get the health people in front of the committee, and they seem reluctant to turn up. So that's sort of concerns along the way.
So as a portfolio...
Oh, sorry.
Beg your pardon. Well, I'm happy to take questions as you want to go along, if that's a more amenable way of doing it.
I'm just going to ask about domiciliary care. It's 25 and then 8 improvement increase in staff hours caused by training and reconfiguration. That's likely to be a bulk now, isn't it? And once it's gone through, will that be an issue at all in the future, either positively or negatively?
With domiciliary care, speaking to Colin Richards, who's the team manager for domiciliary care, we're looking at the Raglan project and looking at widening the Raglan project out, and that's going to be the way that we're going to deliver in-house domiciliary care in the future. We've got a finance task group, and we are looking at the budget hours we've got and what we can give to salaried care workers. So we are looking to bring that in line when we do roll it out, the Raglan model to the wider delivery of domiciliary care.
Can I just add to that, Deb? Would you expect this to be very expensive? I mean, financially, would it be onerous to actually train them in the initial stages? Once it's gone through, will it be all right? I mean, they're now salaried as opposed to paid hourly, which is a great thing. I think it's a wonderful project. But is it going to cost a lot more initially to get it started across, to roll it out across other areas?
They're not all salaried at the moment. We are looking at that, and we are looking to curtail it within current budget limits. So there is no expectation that it will go in excess of the budget. We are looking at what we've got, what we need to deliver with the current client portfolio based on the Raglan approach, and how much will that buy us in salaried staff hours. The actual training of the staff is included in the forecast at month 9. Is going to be initial input for the training, but thereafter we'll curtail it within current budget limits. Okay, thanks.
Councillor Edwards, Ruth?
Just, it says here about the shortfall in income for community meals. Are not so many people taking up community meals now, or any particular reason for that?
With community meals, there was a mandate to increase the income generation by 30,000, and I was looking at increased sales from increased marketing, go more into the private sector. That was on the premise of increasing the weekly sales to a target of about 1,450 meals a week. We're not there at the moment. Speaking to Pauline Batty and Colin Richards, they only just got the new livery for the vehicles. They are looking at a marketing strategy, but unfortunately that hasn't taken off this year. So weekly sales are still at 1,300 a week, which doesn't make up for the increased sales targets from the existing mandate that was brought in this year. So it's not a matter of numbers falling. It's just not a matter of we haven't got a marketing strategy yet to increase the sales for the new mandate target.
Dean, I know you want to come in. Is it on the same point?
Yes, it is.
Yes.
It's just a brief thing that might be of interest, but Wiltshire Farm Foods are doing a lot of marketing at the moment, going around giving talks. They've given a talk to our group, and I think they are taking a lot of the custom.
Thank you. This is an example. It's not the only one in the documents before us today of things that we've talked about in the past. We've had assurances that there will be improved marketing. You remember? University of somewhere or other, was it? Oh, yes. Wasn't Britain? No, that's right. And yet, there still seems to be an issue. Now, it may well be that there's nothing untoward, but I think the committee is quite entitled to ask why it is that progress has not been made in this area as we were led to hope that it would be. I'm not asking you to answer that because you've sort of answered it already. But it's one of a number. I see our old friend Gwyses is here again. And you know, you begin to think that there's a regular list of things that come round and round and round, and these are comets that it doesn't seem possible to land on. Penny, you had some comments, I believe, about the colour coding on this part of the report. Would you like to make them now? It might be.
Look, you know what I'm like with financial figures, and you've made it so much clearer. And then I come to the first grid, I can't remember where it is now, at the start, page 29. And suddenly I've got green is improvement at the bottom of the page, but when I turn over, I know this is not adults, and you go into the operations, it's got red improvement as well.
It shouldn't have red as an improvement. Where are we?
Under operations, we've gone to enterprise, and then, enterprise, top of enterprise, which is the next page, page 30.
On page 14 of our bundle as well, isn't it? There is some.
Yes.
No, it's the same on page 66 that we're on now.
And it's,
Yes. Oh, sorry, yes.
Do you see? The improvement is in red.
Right.
and then underneath it's in green. You know, the colour coding is a little...
Sorry, if I just look at the enterprise one, I mean, the top one is community-led delivery.
Yeah.
It's still showing an adverse overall situation of 70,000, which is why it's in red, because it's adverse.
Right. Okay.
Even though that's an improvement
Right,
on
okay.
37,000
That's-
over and above what month 3 was. So perhaps I've made it completely clear, but
No, because we did think, you know, it's not just me, but okay, that's fine. All right, so we have to look at we don't take it at face value, the colour, we have to look at the whole thing.
no, you take it as face value in relation to, is it an overall
Yeah.
favourable situation to the council or an unfavourable one? It might still be unfavourable, but having improved from
Right.
month 3.
Okay.
But unless it slips across from 0 into a surplus position, I won't actually be showing it as green.
All right, thank you
Yep.
very much for that.
Are you happy
Yes,
with that?
yes, I'm happier.
I mean, we
I
must
certainly-
acknowledge, as we have before, Mark has
Yeah.
gone to considerable
you.
lengths, and all the team have, but Mark has led a particular emphasis on getting these things clearer and more relevant, and so we're happy with that one. Councillor Chapman, Ralph.
Just to go back to what Delia was saying about community meals and Wiltshire farm foods, you know, we should be looking to targeting groups like that when we go out to market, because there is a difference in provision. Say they serve their food frozen, we serve our food hot. And I think that's an important
Tremendous
point that we should be getting across.
Yes,
Can we note that?
Totally agree.
Conclusion. I don't know whether we want to have this matter brought back to us.
I think we should.
I don't know how people want to play this. I'll take advice.
Well, I think actually, Chair, when you're talking about adults who are relying on people providing a meal, it is very crucial, not just for the nutrition, but that somebody is called, you know, regularly to see that they are okay. It's quite a good way of monitoring somebody, especially living on their own. And if they're not getting sustenance, what happens then? They end up in hospital dehydrated or something, and that would be a great shame to all.
And a weekly delivery to the freezer is not the same, is it?
No, absolutely not.
As I know from my from family experience.
Often stays in the freezer.
What would members like us to do about this? Would you like us to ask for this to come back again for an update? An update on the community meals. I mean, we've had some very good discussions about community meals. We've been very enthusiastic about what's provided. We just want to see what we can do to help get that breakthrough that is clearly needed. Members are happy with that? Thank you. Please, Tara.
With the community meals, what I'll do now, I'll liaise with Julie Boothroyd, the head of adult services, and then Colin Richards, the overall manager on this, and then try and timetable that in to come back to Adult Select. But just to add, I had an in-depth meeting with Colin Richards and Pauline Bartley just for Christmas around the community meals and an action plan for actually increasing the intensity of the marketing to try and get us back up to the targeted mandate savings on when this could be achieved. But just to add to it, the ethos of community meals wasn't only just to provide a meal, whether that's frozen or hot. It was also around the safety and the care, and more of an informal one. Instead of putting in direct care services with a care provider at £13–14 an hour just to check on people, this was like an indirect service back in 2008 on an investor save basis, where we brought in community meals and the drivers would then liaise with the social workers as to the health and well-being of the service user.
Well, that is a selling point for the service. Absolutely. And you won't get that from the commercial competitor.
Also a human delivering a hot meal.
Absolutely.
That's the vital.
It's
that isolation thing from being isolated.
and it could be that we look at it again, we discuss, and we think actually, well, okay, there's not a huge amount we can do to change things, but what we're doing is valuable, but we just need to keep an eye on it. Sorry, Penny, you want to come in?
It's okay. I just feel it's very important that we find out what happened to that Cardiff University project, because, you know, it just seems to have fizzled out. That's one thing. Second thing is you've just sold the product totally. Some of us have been out and about with them, and we're very impressed anyway. But, sorry. But we now have a member of staff, Abigail, forgotten what she's called, communications or what is she, publicity manager? Yes, she's amazing. Couldn't we utilise her now and you know really spread the word through her?
I think that's what Pauline's planning to do. It was, from my understanding, Joe Goodwin, and Pauline was working really closely with Joe Goodwin to have a marketing strategy. But unfortunately, Joe went to a new job, and it was just a delay in appointing someone new. And I think that's where the lullers come in, and Pauline is looking to drive that now and take that forward with the person you mentioned. But I think it's just unfortunate that she was working on a good website design with Joe Goodwin, and it just happened to be that she moved on to another role, and it just wasn't filled, and it was just that little bit of a lull.
But just one more thing, please. It's more than just website. We're talking the elderly here, and not all of them are okay with website. We need papers, we need Argus, we need, you know...
I was just using that as one example.
But
That's
don't
not
just
the only marketing one. It was just one of a number of things I could think of.
Sorry.
It's very, very flexible, actually. They do deliver once a week. It's a set time, like Thursday, lunchtime, or whatever, depending on what area you're on. But very flexible. You can have just a couple of meals, or you can have enough for the whole week. And the range of food is very, very extensive. And I've just noticed now that they've now moved into foreign food. You can get curries and all that kind, you know, people like that. And they're looking very carefully into diet and well-being in relation to the vitamins, etc., that they need. And I think one of the selling points that they've got, which you kind of contradicted in a way for your side, was that although you said it's nice to have a midday meal delivered, but not everybody wants that midday meal delivered at that particular time. They like the flexibility of being able to get one from the freezer and put it in whatever time of day they want. I was just trying to give the... I'm not working for Wiltshire Farm Foods.
Yes, I think one of the things they were going to look at was doing evening meals, I believe, when we do this marketing process. Is that correct?
The honest answer is I don't know. There's a number of different strands to this, rather than take up the old debate and detract away from the forecast going into community meals. We do deliver frozen meals. There's another strand we're looking at, and that's possibly developing our own meals. Instead of buying them from Appetito, or supplied to Wiltshire Farm Foods, they supply to us as well. So instead of going to Appetito, we may cook our own and deliver our own meals. So there's a number of things Pauline is looking at in order trying to make up to the new budget. So it's hard to try and go to everything just in this short space of time. So
Okay,
I
sorry.
think, Chair, that we really do need to have this brought back and discuss it fully, because there's so many implications, and you know, no two individuals are going to be having the same requirements, or not everybody would have a freezer if they're living on their own. But I think we do need to be very careful and really thoroughly discuss this, and we'll see which way we go.
no, I agree. It's hard to try and tie it all into like a 10-minute conversation. I'm trying to give you like a brief
It's okay.
overview. I'm
No,
trying to cram in as much as I can.
You've
but
done,
I totally
you've done
agree.
very
Yeah.
well. We're really only asking about this because we want to help. But it is interesting that this topic has roused far more interest across the chamber. And why? Why? Because it's near lunchtime. But it's because it is in the true sense. It's concrete. It's practical. It's tangible, and we can identify with the issues quite readily. So we'd like to look at this again. Councillor Jones, then we must go back to Mark, I think.
I'm sorry, just very quick. It's just to say something. Delia mentioned that Wiltshire Farms did looked at diets, etc., and the nutrients. Well, so do community meals. So I just wanted to point that out for anybody who's listening or watching.
Chair, it's caring as well. That's one of the main things.
So we don't need press and PR people. We've written the pitch. We've already... Mark.
I suspect I'm just about to put the cat amongst the pigeons, to be honest. Just to put this in context, there's a £50,000 adverse variance on a £29.5 million budget. It's probably less than 1%, whilst it has increased by £20,000 since month 3. It's not a very significant variance. And actually, if I were intent to focus my attention, the more sizable adverse situations are around the Mardy Park partnership pressure and the Monovale partnership. You will always find that when a manager brings together a savings mandate, they have the best of intentions as to where they will deliver it. And unless it's, well, some of the cost savings don't result because the plan hasn't been put in place, and in which case that's right and appropriate. But you will always find that with these savings mandates, sometimes things will not work out as you anticipate, which is why it's nice to see that there are savings manifest in other areas. And you mentioned Gwyses. I'd just like to report that actually, in this perspective, Gwyses is actually in a favourable position from an adult perspective. But obviously we need those favourable situations to mitigate against some of the unfavourable ones. And if we could get down some of the more sizable challenges around the partnership pressures, then it would be far easier to manage the small variances around community meals and domiciliary care.
But you know, but we all know it's easier to get very involved in expenditure or of a few thousand, and the bigger sums sort of float by, don't they? We're going to want to look at these two things, aren't we? The two particular pressures that Mark's just mentioned. We're going to have them in our sights at a further meeting. Can we make that note then? So that's which is it again? It's Monovale and Mardy Park. Thank you very much for that advice, Mark.
If I just add one note just to close, sorry Mark, I don't want to detract away. With Mardy Park, there is currently a review of Mardy Park and its usage, because it's more of a community hub, and that's being led by Colin Richin. So, okay, just wanted to add that. Thanks.
We thank you for that. We have. We have had insights into this and other matters going forward as a committee. It does strike me that an awful lot rests on Colin's shoulders, and it's unfortunate that we can't make that point to management directly today, but we know why that is so. Mr. Howcroft, do you want to bring any other matters to our attention?
Yeah, I'd just like to explain some of the benchmark analysis. What I said at the start of the year was that I reflect on the fact that when we come to budget setting time, the amount of time and effort that is spent actually bereaving the loss in budget every year, whether we have a similar perspective in whether the budget that we still have is well spent. So what I was intent to do and challenge myself is to actually look at similar information from other councils to see whether we were cost effective or whether that pound spent was well spent. It built upon work that we did for children last year in approaching it from a unit cost of delivery. So we've tried to do something similar around population figures and proportions of clients that are useful to it. The table in 4.2 is my judgment of whether we're similar to other local authorities. And what I would say is that I think we evidence a very similar elderly profile to others. I've compared it to 3 similar semi-rural authorities. I'm afraid I'm not allowed to report the actual names of the authorities because one of the requirements of using that data is a degree of confidentiality in terms of using benchmark information. And I've also compared it to a near neighbour and a city that's not too far away. So I'll leave you draw your own conclusions around where those information comes from. But probably the best comparison is against semi-rural rather than city, because I think there are certain economies of scale in provision of social care services around a metropolis that aren't evident in a rural locality. We evidence a very similar proportion of population that would utilise adult services, both in terms of the 65 and unders and the over 65s. It also evidences our approach to supporting the community rather than proportionately less supporting care homes, which is obviously a flavour of our strategy in providing adult social care. Paragraph 4.5 goes on to the detail around unit costing then, unit costing per head of population. Our spending, interestingly, is proportionately more in the under 65s than in the over 65s, which I'm concluding is a symptom of our early intervention work and actually being able to support people in the community rather than necessarily in that care home facility. But proportion of social care spend on adult in comparison with others, well, it's more than I found in a city or in immediate neighbours, but it's very similar to semi-rural, which is why I come to the conclusion that actually in a semi-rural context where you're trying to provide services to people in their home environment, it's generally a slightly more expensive prospect than to provide it through an institutional approach. In terms of looking at the unit costs, what you can be assured of is that the unit cost of provision compares quite favourably to others. That is something of a double-edged sword to you as members when it comes to providing savings in services. You can be reassured that the advice that you get from senior management team is good in the provision of services and is quite cost effective, but it does mean that there's no obvious areas of waste and extravagance that allow the savings to be achieved in an easy fashion. And then part 5 there, you'll remember that in quarter 1, I approached this from a point of view of suggesting various questions you might ask the social care management team. That really presupposed that actually those members of staff would actually be here. And I'm pleased to say that actually in refining that and actually getting a written commentary from the director, A, I think you'll find that more robust than simply answering questions, and B, it obviates the fact that if people have unfortunate double commitments, you still get the answers to the questions that you're asked. And then the last thing I've done as a refinement to month 3 is that I've actually put the link to the monitoring information on the hub so that it doesn't clutter up the paper and make it less readable. I hope no one's had any problems of accessing that information in the hub, but obviously if you have any reflections or feedback that you'd like to give me either separately or as part of this meeting, I'd be glad to receive it.
I mean, 1 or 2 members have reported sort of general IT problems this morning. Whether they were able to get as far as the point that you've just asked us about, I don't know. Pauline, sounds as though you weren't.
No, I'm not on my
I mean, what I would say is that tables that I've included in there are pretty much synonymous with those reports. So you do have a quality of information on which to make an informed opinion on, but I appreciate it's not the same level of information that others have got access to.
Can I just ask a very simplistic question? MCC, how would you describe that authority? Is it semi-rural as well?
Yes.
Yeah, okay, thanks.
There was a mention on the news last night, which was greatly in our favour, but it might bring more pressure, that you were most likely to live to over 80 in Monmouthshire than what you would do in Blaenau Gwent. So we can perhaps find more older people will be coming to live with us that they wouldn't have done otherwise.
Sorry. I was disappointed that adult education hasn't appeared very much within our purview of these matters today, and I don't know why that is. I guess it's partly because it's in another directorate. But I know, Mark, you took great steps to try and get things, shall we say, more sensibly lined up a while ago. But at the minute, we're not able to get much of a feel for adult education through this committee, and that disappoints me. Councillor Watts, I'm sorry.
Yes, surely the adult education comes under leisure centres, as it always has done.
I thought we'd taken a different view.
No?
Because we looked at the budget mandate last time for adult education. Maybe this isn't the place to articulate it. Maybe you are.
I can probably provide a bit of clarification here, and I suspect I'm part of the problem rather than part of the solution. In trying to give members a better quality of finance report, there's certain pragmatisms I've had to adopt, and one of those is to report on the basis of functional directorates. And as Councillor Watt says, that at the moment it's administered within the Enterprise Directorate and falls part of the community-led delivery under Deb Hill-Howell. That's not to say from a service perspective that simply as the monitoring is reported to that committee from a point of view of Select's view of budget monitoring, that you shouldn't receive or you shouldn't expect to be able to call on adult education to come to this committee. It's just that when it comes to chunking up the various accounting statements.
No, I appreciate that, and I think, Mark, you're right. But we as a committee, we have in the past asserted in various ways, not only in our own meetings but in other fora such as the coordinating board, that we actually think adult education is a part of our field of interest. We realise that, of course, it is a different directorate, but that shouldn't make any difference. You members will recall that we get regular reports on housing and housing solutions and all of that. That's not part of social care directorate either. So it is possible for directorates to contribute to a committee whose admittedly primary focus is not on their work. But I mean, I'm in members' hands here. I don't want to sit here every time and parade my obsessions. If people feel that they're not actually that troubled, and that if adult education is being looked at elsewhere, then so be it. I'd really like to know that. It might be something we talk about privately afterwards.
Can I suggest a compromise to you?
You can indeed.
As this report is the one that goes to Cabinet, and as it's the same report that goes to all the selects, that information is already in the body of this report. It's just referred to under Appendix 3. So appreciating your interest in it, if I simply extract that part when we come to the presenting of this thing on a quarterly basis to actually give you a view on adult education, would that suffice?
I think that's excellent and typically helpful. Thank you. Councillor Chapman, then Councillor Jones.
Can I just ask where adult education is scrutinised, if it doesn't come there?
That's behind my question. I don't actually think it is. Or if it is, like you, I don't know where. And it's something that we will want to pursue. I think perhaps when we get the opportunity. Coordinating board is, I think, the place for this, and I would gladly take that forward on behalf of the committee into that forum. It doesn't meet as often as it used to, but it does still meet, and I forget when the next meeting is.
Do you want me to give you that update on adult education?
I think that would be excellent, yes. Thank you.
This is about my obsession now. It's 4.7, page 17 and 69 of the bundle. And it's when comparing adult unit costs between councils about your life, your way. Basically, it's the last part of the sentence of that paragraph. But it would be my intention to test this further to establish whether MCC is potentially incurring care costs earlier than it needs to. Does this mean that you would raise the age of seniority, 60 to 65? Because I do know, and Delia's sitting behind me, that it is age concern starts at 50. And I really feel, and have felt strongly for a very long time, that a considerable waste of money has gone into this area by looking after people as young as that in this day and age when everybody is supposed to be at least 10 years younger. So what age are you thinking of?
It doesn't reflect any particular choices. It's just me being nosy. It's something that I recognised during the benchmarking situation, that I didn't have the extent of information I needed to come to an informed judgment about. And actually I put a marker down in my own mind that actually this is something that I would like to test out. Now, if it's a choice for the council as a consequence of that, then I can find some evidence that that would be a more economic source of provision, then I would bring that back probably through the Director of Social Care. But it's more about the way that I approach understanding these services, and I hope that's some use to yourselves in...
It is, I mean, it does annoy me in a variety of ways, but mostly it's economic, from the economic point of view I was thinking of. You know, I'm thinking of things like bus passes at 60 and all those things when people now are having to work much longer. So we're giving bus passes and we're looking at free whatever to people who are actually working, and it just doesn't seem economical anymore. So I'd be very interested in the results of your survey.
So I've created a bit of a rod for my own back in asking myself the question then.
The only thing I would add is whenever we are agreeing to the provision of care is always marked against the eligibility criteria that we've got set anyway. So no, exactly, but it does meet the eligibility. Like, for example, we omitted a couple of years ago low-level provision from eligibility criteria, such as cleaning, shopping, and stuff like that. So whenever care does come across, social work is always marked against the eligibility criteria.
I'm grateful to Mark for his research. It's not the first time that officers have brought before this committee very, very useful and pertinent comparative information. If I recall, Chris Robinson did something similar in the case of supporting people, looking at the costs across and where the money was spent in different authorities. And the insights that Mark is offering are, in that sense, not dissimilar. We get a better idea of where we are in comparison with others. So you will do something for us on adult education, will you? Is that okay? That's not too much of a burden for you, is it?
Absolutely not. It's in the body of the report, so I'll just refer you to slide and take it to it now, if that's all right.
Okay.
So we're looking at page 61, which is Appendix 3. It sits within the Economy and Development Select portfolio only from the basis of that's where Enterprise Directorate is reported to, and obviously adult education is part of Enterprise Directorate. It appears under community-led delivery. The head of service for that is Deb Hill-Howells, that most of you will know. It sits alongside libraries, and actually it shows an adverse situation as at month 6 of 81,000. There was a mandated saving of £90,000 as part of the 14-15 budget setting process. You might simplistically equate it to those savings not having been made, but actually the problem and the challenge is more onerous than that, because colleague Gwent over the summer suggested that they were reducing their funding to adult education and effectively took about £250,000 out of the situation. And adult education colleagues were effectively given a month to realign and re-engineer the service to result in a zero bottom line. They haven't managed to do that fully yet, as evidenced by this £81,000 overspend. But what they will need to do is, obviously, if that franchise income isn't there, is to take out similar levels of costs and refine levels of courses accordingly. But in that short time scale, obviously, they've had to honour certain ones that they were.
Thank you. I think we really do want to hear from the adult education team. There's a lot going on. Buildings are being reused or not, or potentially put up for sale. There's been some quite significant changes in Chepstow in terms of how the library, the youth and the adult provision is located and where the boundaries are between the different parts of the service, because some of the work they do is interchangeable. There's a whole lot of stuff like that. I'm just thinking of Chepstow as an example. I don't know how it would work out anywhere else. But I think it would be timely for us. So I'll raise it at the coordinating board. We'll record it in the minutes that we would like to have an opportunity to be brought up to speed with all aspects of what's happening on the adult education side. And obviously, if there are any specifics, like the colleague Gwent situation, that will be caught up in it as well, I hope. Members satisfied with that? Are there any more questions for Mark and Tyrone? Obviously, we want to keep them sitting here for as long as possible. But are there any more questions or points that people would like to make?
Please. Just a point going back to Wiltshire Farm Foods again. It's just that rather than not taking any notice of the competition, we should really embrace the competition and see what they're doing that we're not doing, that they're doing so well, because they're, and I don't think we should just just reject them. I think we should, really take notice. And it might be a good idea to get a supply, discreetly, we couldn't do it through Monmouthshire County Council, to get copies of the brochure to see what they are offering now, because it is really, quite a lovely brochure to look through and very enticing to the elderly. And I think we shouldn't ignore them.
Chair, can I just...
Sorry, just going back. I'll take that back to Pauline Bardi and Colin Richards. In terms of the Wiltshire Farm Foods brochure, we have viewed that online because it is online. So Pauline has looked at that extensively. So I think she's already got that in hand. But because I know when I saw her in December in Raglan, we were actually looking on the website as to what is available, the pricing strategy that they incorporate, and we've looked at ours as well. But I will feed that back into Pauline so we don't lose sight of that. Thanks.
Thank you, Chair. With, like you've just mentioned, and competing with them, right, I think we're better off going out on our own and doing something far greater than what they are doing. Like, we spoke here last week on advertising this cycling that's going on throughout Wales soon, and they wanted to know how to help advertise it. So I said, well, all the leaflets will be going out to everybody to pay their council tax soon, right, from here, thousands and thousands. So why don't we advertise it with that?
Sorry, I'm rapidly losing the plot here. I'd like to thank Mark and Tyrone for so helpfully and ably, as usual, leading us through this material. Mark, did you want to?
Yeah, sorry, I just wanted to give you a heads up. We're actually bringing forward the revenue monitoring for the third quarter. It's not lost on me that actually members get that information largely at the death of the financial year with very little ability to do anything about it. I don't think it will necessarily affect when you will receive it as a select cycle, because obviously that falls off when it gets received by Cabinet. But just to put it on your radar, the third quarter monitoring will be going to Cabinet on the 4th of February, which is a month earlier than it would normally go. So, yeah.
Thank you very much.
That's why I got bags under my eyes. Because I can't. But just following on from Mark said, I've done draft figures that we're currently looking to refine, but there's not going to be too much of a movement anticipated from month 6, which I think is down to the good work of Julie Boothroyd, Head of Service, and team managers, people like Colin Richards, trying to maintain the status quo.
I think that's very helpful, and it's only fair that we should record that we recognise the continuing hard work and efforts of the team to control and manage all of the things that we've been talking about. And I hope that we've not been thought to be saying anything different. And in asking for more detail on certain things, it's because we want to know more rather than because we're sort of particularly agitated about what they're doing or not doing. I think that's an important point, which I know, Tyrone, you will take back.
Yeah, I don't think it's seen as that. Yeah.
You have, and very ably, and we appreciate that. So we can discharge you two. Thank you very much. Thank you both. I don't think we need a great deal longer, colleagues, just to refer you to the forward work programme. Councillor Chapman.
Can I just ask, Chairman, on that, will we be having somebody from the Health Board, it does say here, on the 17th of February for the morning?
You will have the Chairman and the Chief Executive. I can't do better.
There we go.
And I'm going for a private meeting with the Chief Executive just to communicate to her some of the current thinking and concerns of the committee. The meeting is a way of giving them an opportunity that they were seeking and us an opportunity that we were seeking to revisit things. So we're certainly going to have the Chief Executive, Judith Paget. I'm very pleased that we will be welcoming her, and we'll be welcoming her here for the first time to this committee as the Chief Executive. But I believe that for at least some of the meeting, the Chairman of the Board will be coming as well. So I think members should feel that we are getting a response from the Health Board at the highest level. It's been difficult to arrange, but Hazel has managed it with the help, obviously, of people in the offices at the Health Board. And I just hope that we will take the opportunity to come and listen to what they have to say, but also to ask about what we want to know. Does that help you, Ralph?
Budget says probably it's not in the budget in the diary. No, it isn't. It's a special, isn't it?
Well, it's the
It is special.
It's a special 24th, unfortunately, because that's a budget week, so it's very good.
isn't it it's the 17th?
17,
Yeah, which is special.
Yeah. I know there's always going to be a clash, isn't there? But
You're right.
17th, that would be great if people could manage to come to that. And I will be meeting Judith, as I say, ahead of that.
Chair, are we going to, it will be an important meeting. Do we want to, I know all county councillors get all agendas, but do we want to flag it up for any interested member to come along and sit in?
Point. They always have the
They
option.
don't really, we get so much information, we may not know, if you know what I mean. Do we specifically let them?
So what's the normal thing? The papers for a committee of which, as it were, you're not a member, get sent to you anyway.
If you download it if you want.
The agenda, not all the papers.
The agenda.
The agenda goes to everybody. I get it for licensing.
I think so. I think it should be enough. It'll also be interesting to see whether it attracts any interest from members of the public, and I rather hope it does, because in the interests of democratic accountabilities, this is another opportunity for people to hear directly from the Health Board.
Can we ask the, whatever they are, the ones, the new manager that we've got to put out a press release? Abigail, yeah. This is important. This will be happening.
Yeah. Are there any other matters relating to the Forward Work programme? Is everybody content with that? Well then, in that case, thank you very much for your time and your contributions, and I will declare the meeting closed.